Can I safely stop and restart my weight loss medication later? Before we dive in, a quick note. This video is for educational purposes only and is not medical advice. Always talk to your healthcare provider before making any changes to your medication. If you're taking semaglutide for diabetes or weight management, you might be wondering whether you can stop and restart it safely. The short answer is yes, but there are some important things you need to know first, and it absolutely requires working with your doctor. Semaglutide is a GLP-1 receptor agonist that works by helping your body manage blood sugar and appetite. It enhances insulin release when your blood sugar is high, reduces glucagon, slows how quickly your stomach empties, and helps reduce appetite through pathways in your brain. These effects only happen while you're actively taking the medication, which is why stopping and restarting requires some planning with your healthcare team. Let's talk about what happens when you stop. Semaglutide has a 1-week half-life, which means it takes about 5 weeks to completely leave your system after your last dose. During that time and after, you'll likely notice changes. If you have type 2 diabetes, your blood sugar levels will typically start to rise. If you've been using semaglutide for weight management, research shows that weight regain is common after stopping. This isn't a failure on your part, it's simply how the medication works. When it's not in your system anymore, those metabolic effects go away. Now here's the crucial part about restarting. If you've missed doses, you can't just jump back in where you left off. Your prescriber will typically restart you at a lower dose, even if you were tolerating a higher dose before you stopped. This is really important because it helps minimize gastrointestinal side effects like nausea, vomiting, and diarrhea. Your body needs time to readjust to the medication, and your doctor will guide you through their individualized plan for getting you back on track. There are legitimate medical reasons why you might need to pause semaglutide therapy. These include acute pancreatitis, pregnancy or pregnancy planning, certain surgical procedures, gallbladder disease, or severe allergic reactions to the medication. If any of these situations apply to you, talk to your doctor right away about whether you should continue treatment. Sometimes interruptions happen for other reasons, medication shortages, financial constraints, or side effects that are hard to manage. Whatever the reason, don't just stop on your own. Have a conversation with your healthcare provider first. They can help you create a plan for managing the gap in treatment. So what can you do during a treatment break to maintain your progress? This is where lifestyle modifications become even more important. Keep up with the dietary changes you've made while on semaglutide. Continue regular physical activity. If you have diabetes, you'll want to intensify your blood glucose monitoring during this time so you and your doctor can catch any concerning changes early. These strategies won't replace the medication's effects, but they can help preserve some of your metabolic gains. When you're ready to restart, work closely with your healthcare provider. They'll guide you through their gradual reintroduction plan, which means starting low and slowly increasing based on how you respond. This gradual approach is the safest way to get back on track. Don't try to speed it up or skip steps, even if you feel fine. Your body needs that adjustment period. It's also worth mentioning that every person's situation is different. What works for one patient might not work for another. Your doctor knows your medical history, your current health status, and any other medications you're taking. That's why personalized medical advice is so important here. If you experience severe side effects when restarting, contact your doctor. The same goes if you notice your blood sugar levels are difficult to control during a treatment gap. Don't wait for your next scheduled appointment if something feels wrong. Here are the key takeaways. Yes, you can stop and restart semaglutide, but always do it under medical supervision. Expect metabolic changes when you stop, including rising blood sugar if you have diabetes and potential weight regain. And when restarting, your prescriber will create an individualized plan to help your body readjust safely. The bottom line is this: semaglutide is a powerful tool for managing diabetes and weight, but it requires ongoing treatment to maintain its effects. If you need to pause therapy, work with your healthcare provider to create a plan that protects your health during the gap and sets you up for success when restarting. Remember, the comment section isn't the place for personal medical advice. If you have questions about your specific situation, reach out to your healthcare provider for individualized guidance. If you found this helpful, give us a like and subscribe for more evidence-based health information.